Sarah, if you could tee up the presentation. Well, good afternoon, everybody. I hope you all had a great weekend with the nice weather and were able to get outdoors. I'm, again, Jason Balling, Director of Public Health. Deb Fettersfield, our Deputy Director, is here with me, along with Sarah Mock and Jeff Romine and others from the City and County Manager's Office are also on the call. So we'll dive into the latest information we have on COVID. So the changes we've seen since the last week, we had 111 new cases, but the good news is we didn't have any additional hospitalizations and no additional deaths. And I'll get into a little of this later to talk about some of the reasons why this might be starting to trend this direction. So again, our simplified dial framework is we're currently in level blue. We still have listed our 7-day case incidence metrics down in the appendices data, but what we're truly tracking now is the severity metric as far as hospitalizations, and you can see we're doing extremely well in that area. So some of what we're seeing statewide is there's some early signs of stabilization in the cases and the percent positivity. That's good news. We'll want to see if that continues as a trend. Our hope is that we're starting to see those that are fully vaccinated making a difference in the number of cases and the positivity. The bad news, though, I have to share is that we are seeing an increase in cases statewide among school-aged children. And again, the primary driver is not specifically within the school setting. It's those things that are happening outside the school setting that are driving those cases. Younger people, those 20 to 64, are also driving the epidemic and leading in hospitalizations. What we're seeing is that there's a higher vaccination rate amongst the older population, the 65 plus, which makes sense. That's where we started the vaccine campaign. But we're also seeing changes in personal behavior, which we've talked about over the past couple of briefings. And then again, in the state, the increased prevalence of variants. Right now, the main one is B117. And again, want to emphasize, and we have this in our appendices, we list all of the variants of concern. This specific variant, the vaccines appear to be effective against. And then again, the Colorado School of Public Health estimation that 69% of the population will be vaccinated by May 21st. And at this point, about 30% of Coloradoans are immune due to previous infection or vaccination. One thing I really did want to emphasize on is what we're seeing is vaccines do work. And so the state presented this last week during their press conference, Dr. Rachel Herlihy, the state epidemiologist. And what we're seeing is the hospital admissions are primarily occurring with those that are unvaccinated, whereas those that have been vaccinated, and even those with the breakthrough cases, we're seeing minimal hospitalizations. And I'm talking about those that are fully vaccinated. So the good news is we know that the vaccines do work. And when we are able to get our populations vaccinated, that we're seeing hospitalizations are going down among that population. Next slide. As far as in Broomfield, I already mentioned some of these, but we do currently have a 156.9% incidence rate. Our positivity is still hovering around that 5 to 6%. Similar to what the state was reporting, we're seeing our highest case rates are among the 10 to 19-year-old population. And then after that, among the 20 to 29-year-old population. I think most concerning for us is, again, that 10 to 19-year-old population. We know that those 16 and older are eligible to receive the Pfizer vaccine, but we have the high percentage of those that are between 10 to the 18 age that don't have access to a vaccine and still susceptible to contracting COVID. As far as our vaccination progress, 45% of our eligible population has completed their vaccinations. 22% have initiated it. So in the metro area, we're doing really well with those that are completing their vaccines. Whereas we're hearing from some other counties, they're seeing people that are completing their first dose and not coming back for their second dose. So we hope that that trend continues in Broomfield. And then again, our goal is ultimately herd immunity is somewhere between 70 to 85% to try and get our community there. Still encouraging people to get tested, and then you can see the latest updates on our variant cases. Again, we fully anticipate that the state isn't capturing all of our variant cases in the Denver metro region, but thankfully we haven't seen any additional Brazilian variant cases here in Broomfield. Next slide. So I'm sure you all saw the news this weekend. Some of the major updates on the national front is the Johnson & Johnson was authorized for use again by the Advisory Committee on Immunization Practices. Again, they reviewed all of the data, and this is typical what they always do with vaccines when they see potential side effects. Again, the safety protocols are effective in identifying these rare events. This is exactly what we want the public health system to be able to do. The good news is the FDA and the CDC have confidence that the vaccine is safe and effective in preventing COVID-19, and the data shows that the vaccines, known and potential benefits significantly outweigh the potential risks. However, similar to what we would do with other vaccines is when we're aware of some of those potential side effects, the Advisory Committee on Immunization Practices has recommended we distribute vaccine fact sheets that have updated information to communicate about the potential risk of the blood clots. As far as our local vaccine efforts, we're getting to a point where we're reaching that wait and see population. This isn't necessarily our vaccine hesitant population. It's been that group that's been out there wanting to see what the potential side effects may be, looking for the convenience factor and other issues before they got vaccinated. So with our mass vaccination efforts, specifically at the First Bank Center, we're starting to get to the point similar to those other mass vaccination events in the Denver metro region, where we're not seeing them fill up as quickly and with as many people as we were hitting in the past. And that was the intent with that First Bank Center effort, was to have mass vaccination events where we could get a majority of our population with our supply. Now we're going to have to shift our focus and really start to look at how do we remove those barriers and facilitate access to the vaccine. And some of this will involve us doing it after normal business hours, also potentially bringing the vaccine to where we know people are at. And so our team's been doing a lot of work in this area, and we'll have additional updates to provide. Additionally, we'll focus on our 16 to 29-year-old population and those in the other age groups, because these are the groups that we're primarily seeing as in that wait and see approach. And so, as I remember when I was in my mid-20s, convenience and the ability to do something quickly was always important to me. So our hope is, how can we do that at the same time, making sure we're reaching some of those essential personnel that may not be able to get time off to get a vaccine during the day. And just a reminder of where we're at, and also the Denver metro region. Again, we're currently in level blue. And you can see all the capacity limits. On May 16th, we'll be moving towards level clear in our observational period. And I just think it's really important as we talk about sort of where we're at in the transmission of this virus, as we begin to move to that observational period. That doesn't mean that we just completely go back to normal. We're going to still have public health guidance that's out there from the CDC and from the state health department that we would be reaching out to specific sectors, businesses, and others, and the general public to say, here's our recommended best practices as far as preventing transmission, which still in certain settings may be encouraging mask wearing. It may also be encouraging 6 feet of social distancing. And it also may be also educating our public on some of those more riskier events or situations they may be putting themselves in if they're unvaccinated, and just being aware of that for themselves and for their family members. So I want to be just extremely clear with the public that going to level clear doesn't just mean everything is completely back to normal. Public health will always keep providing the best information and recommendation to our residents on how they can best protect themselves from transmission. The other thing I wanted to mention with this, as well as the metro region, as you know, a lot of counties passed local mask orders. Some of those counties are looking to extend their orders. We're also waiting to see what the state will be doing with the state mask order. That again expires on May 2nd. From there, I think we'll have a lot more information of what that means for Broomfield, in addition to the data that we have. And I think we're just in a place to be completely honest as we start to move more into seeing our population being vaccinated and fully vaccinated. And also people that may be in the sort of wait and see approach of what's that true balance we want to take, not from a public health perspective, but more from a public health orders perspective to mitigate transmission. And is mask wearing still the public health order we want to continue as we move forward? And then next slide. I believe that's it. So we could go ahead and open it up to questions. Councilmember Grimm, you came up first.
Oh, sure. Could you put the last slide back up? I've been talking to a few business people, and I had some questions about our diagram. So moving into the observation period, and I know we're still waiting on the metrics, but right now we're at 100% capacity for those areas, but the mitigation practices is they still need to be 6 feet apart. So there's a lot of businesses, especially restaurants, that are still at 40% or possibly 50% capacity because of the 6 feet. So coming up, if all metrics still are thumbs up, when we go into the next phase, the level clear, with no restrictions, that means that they can truly be at 100% capacity without the 6 feet apart. When we say 100% capacity, that means they're at 100% capacity per their square feet, per their business plan, correct?
That's correct.
Okay.
Yeah.
And there wouldn't be any restrictions at all for restaurants, well, pretty much for anybody, right?
Correct. Unless the state has a public health order that remains in effect, but from our local order, there would not be restrictions in place.
Because I guess my concern is we're going, like right now, restaurants, gyms, all those, we're really focused on that, but the bars have pretty much been shut down through this time. And in level blue, they're at 25%. And now bars are going to be, they're going to go from like 0 to 100 with no restrictions. And I guess for me, if there's any category I'm worried about is bars, because that, when you're talking about social distancing, there is literally none. When you're looking at going to sit down at a restaurant, even if the restaurant's opened at 100%, there is some distancing, you know what I'm saying? But bars, I'm just really surprised that we are going to 100% with no restrictions on bars. Can you just walk me through that? Are we doing that just because it's simple and we're going to level clear and like ripping that Band-Aid off, or what's the concept there for bars?
Yeah, that's a good question, Councilmember Groom. As we discussed this at the Metro directors table, we were discussing what remains as a public health order versus what becomes guidance. Obviously,
sure,
anywhere indoor where you're not achieving 6 feet of social distancing and wearing a mask are problematic. And bars, I believe, I agree with you. And you're also have alcohol involved can create greater opportunity for increased transmission. However, we got to the point where we said, are we just going to be singling out one specific industry as we move into the observation period? And that was the point where we said, this is going to take strong education on our part, with the business community and the business sector, and also with the public, to say, if you're going to be visiting a bar and that you're going to be potentially at increased risk, just being very aware of what that means if you're not vaccinated yourself, and you can't assume that anybody in there, everybody in there is vaccinated as well.
I see. So, I guess we never really have had bars at any kind of capacity through any of this. So maybe that was something we should have in level blue even put at 50% just to get us used to it. But all right, I didn't know. I think it's a risk moving bars to level clear, but I get it. It's more of at level clear, we're starting to make it more of a personal choice. Understand your risks as you're transitioning through your life on what that means. Bars are going to have a higher risk than obviously going to a restaurant or frankly staying home. Okay, got it. And then my question is with the different variances that are coming out, not variances, variants. I think I pronounced that wrong. are any of those variants with people that have had the virus or have had the vaccine?
Yeah, so it's another good question. And there's a couple things that play into this is, it depends when you had the virus. What we do know is if you've contracted COVID in the past, did you have it last March or did you get it in June or did you get it in December? Because that immunity that you build up from contracting the virus wanes over a period of time. So that's one thing that plays into that and the variance of potentially people being reinfected. The second thing is that we are seeing the vaccines, again, are not 100% perfect. So there are breakthrough cases that are occurring in the state. And those are amongst individuals that may have received one dose or been fully vaccinated, and they're still coming down with COVID. And one of our slides, Sarah, if you could pull that slide up in the appendices, talks about the impact of the variants on specific vaccines. And my understanding, there we go, is the South African variant is the one where the vaccines may be less effective against it. Again, the data is still emerging, I should say, in all of these areas. And then the same thing with the Californian variant.
Thank you for that. That's interesting. And then going with the antibodies, I know that because I'm involved in a blood study as well as a couple other people I know, and I know two people that are in, we give convalescent plasma, and they had it back in early April when it first started, and we're all tested for antibodies, and they still have their antibodies. And of course, I had it 6 months ago, and I still have it. And now the convalescent plasma has changed to the blood donations because the technology's there where we don't have to be hooked up to the weird machine for 2 hours, and we just give blood. But it is interesting that the people in the study, I don't have insight to the study, but the people that I know, we all still have the antibodies. So I was wondering if you have access or insight to any of the blood studies that are going on about the antibodies.
Not at my fingertips, but let us follow up on that, gather more information. I know Dr. Urbina has been tracking that closely along with Ashley on our team. So we'll follow up on that.
I mean, I know we're focused on trying to get people to take the vaccine, but I think it would be interesting to see truly what is that and how long the antibodies are lasting, because I'm on my 6th month and I'm still donating because of it. So it's an interesting study to be in.
Yeah, well, I appreciate you doing that and sharing it. And yeah, we'll gather that information and share it with all of council.
Thanks. That's all I had. Appreciate you guys.
Yeah, thanks, Councilmember Grimm. Councilmember Hinkle.
Thank you for your presentation today and all of your guys' hard work throughout the entire year. I feel like we are seeing some light at the end of the tunnel, but also keeping on our toes as well. I have a few questions, and I think I'm just going to try to ask them all at once because they kind of intertwine a little bit. So I went to an event at the Omni on Saturday night, and part of the event was standing though. So they're standing, eating appetizers and drinking from about 5 o'clock to 6:30. My husband arrived at the end of that, and we were noticing everyone was standing around, no masks on, eating and drinking, which for us, we got our drinks, we left our masks on, took a drink, put the mask back up. But for most people, they were not doing that. And so my first question will be to your public health team as to, I'm wondering, Councilmember Grimm talked about, bars and what that might look like. I'm wondering if it's not so much a shutdown as it is, hey, here's the procedure for drinking at our bar. You take a drink, put your mask back up and chalk. I don't know how enforceable that is. And I can't imagine past midnight that would be totally enforceable. I don't know what that would look like. But once they sat down, we had dinner and then we would mask up again. And then we only talked to a couple of people because I didn't feel comfortable walking around. So that was sort of my first question. My second question is that I was talking with a business owner at this event who was sitting next to me. And she said that she owns a veterinary business. It is not in Broomfield, but she was frustrated that her, and this might go to Jeff Romine, and that the business owners are getting frustrated, I think, because their employees, if they've been exposed to COVID, they are expected to quarantine for, 10 days. And then the business owner is expected to pay them for that amount of time. And she says it's getting over the top where I have a hard time even getting employees, first of all, and then retaining those employees day after day. And I have to keep paying them. So I'm curious as to what's on the horizon for that. And then my last question kind of goes back to the public health department. I'm wondering if we go to level clear, if we're still going to require masks. I think we need to be very, very cognizant about if we say level clear, what that means. And if we're still requiring masks, I really feel strongly that we should call it level clear with a mask or something like that, something in the name. Because that will give people who haven't been wanting to wear masks, which, to be honest, I mean, who really does want to wear a mask all the time, right? We didn't sign up to be doctors and nurses all day to work, in those environments. But, I think we have to be very clear from the get-go. It's level clear with a mask. So if we can answer those questions, I'd appreciate that.
Sure, I'll let Deb and Jeff take the first two.
Thanks, Jason, and thanks, Councilmember Hinkle, for the question. So I think at this time, I think your first question was related to could we make recommendations on mask wearing and best practices as we move into level clear. And I think that is the intent. Jason was talking about that a little bit earlier, that even if there's not a public health order dictating activities, because we are at a place where we have a tool to prevent against transmission of COVID in the form of a highly effective vaccine, that doesn't mean that we throw all personal precautions out the window. And so just really kind of shifting that message back to, but continuing to reinforce the message of risk assessment that each person has to take in different situations, and what can you do to mitigate risk. Here's things that you can do, and making that available widely, I think is certainly one intent. In the short term, while we do have a mask order in place and a simplified public health order in place through May 15th, the mask order through May 7th, we will continue when we learn about situations. Our approach has always been to reach out to the entities directly and educate and make sure that there is an understanding of what the current protections are in place. So I think the short answer is that we would intend to do both. To enforce the existing orders in the short term, and then when we move out of the simplified dial to level clear, to shift to education only. Jeff, I don't know if you wanted to add anything on that before we get into the next thing around the paid sick leave.
Sure, and that is a couple of things. One is Deb and I will reach back out. Deb and I both have been talking to the Omni over the last year about various things as they've tried to figure out how to operate. So we'll reach out to Jerry over at the Omni and remind him both that the face mask order is still in place, but also just to encourage them, as we're going to do with all of our businesses, that they should do other things to protect public health, but more importantly, to assure their customers that they're still following and trying to trying to bring the best things forward. And And our businesses have tended to do that. They've tended to want to be leaders, and they recognize that part of their customers are still concerned, and legitimately so. As Jason's pointed out, the variants are out there and other things are out there. So we're going to send that message again, and we will do that, both to Jerry directly, but also to all of our businesses.
And to piggyback on that too, with certain businesses like that, can you speak to if they've even changed? I did feel a lot more airflow than I've been in there before. I do not know if they made changes to the airflow or if we can support our businesses in sharing and how they have changed throughout the pandemic. I mean, even Blake's Tap House actually changed their seating arrangement permanently because they said actually the more people we had in this inside room is harder for our waiters and waitresses to get around. So they actually have changed and moved things outside even more. So I don't know if we can help them.
Yeah, I would say there's three things that we're going to try. And Deb and I haven't figured out if we should give it a cute, I don't mean cute, I mean a marketing label or something like that. But we want to encourage the continuation of the HVAC improvements, which should be done for all businesses, whether, in the flu season of a regular winter, that would help and stop some of that spread. Two, as you point out, distancing. And Deb and I and Jason have been in a long conversation about 2 feet is too small for even humans to really have a pleasant dinner sometimes. Perhaps 6 feet going forward isn't the right measure, but there's somewhere in between that. And to encourage, as you point out, for server safety, for customer safety, and things like that. And then the third one, which I think we're going to encourage them, we want to reinforce, not that they don't do it, but we want to reinforce that there's been a lot of good practices with employees around how they more frequently sanitize and do other things, not just when they go to the bathroom. We've all seen those signs, but just on a regular basis. And so those are three things that we think should be continued in some form going forward with many of our businesses. Finally, the last thing, and I don't know the update, maybe Deb does, on how, if, because for a while there was some compensation that could be received from the federal or state government related to some of that sick time related to COVID. But I do know that as part of the last stimulus bill, at least to encourage people to get tests, the president had proposed providing a tax credit to smaller businesses, those that I think were employing roughly 100 or less, maybe it's 200 or less, in order to encourage those employees to go get it, much like we've heard with the state prisons and others, where they're giving bonuses to employees to go get vaccinated. And I know Deb, and we've tried to encourage our businesses. Deb's asked me specifically if there are any businesses that we know of that we want to encourage their employees to get vaccines, that we're getting to that point where we'll be able to get them in mass, perhaps, so that they can sign up as a group rather than sign up as individuals. So I think those are all the measures we're thinking about in order to encourage and continue this progress forward that everyone's worked so hard to get to. Deb, I don't know if there's any other points you want to make.
I'll just touch on the last thing, and then I'll hand it back to Jason to talk about the mask order specifically. But I think Councilmember Hinkle had also posed a question in there about the paid sick leave. And so under the Healthy Families and Workplaces Act, their employers are required to provide a new supplement of up to 80 hours of paid sick time for preventive care, which can include time off to recover from illness, or so if you are quarantined, as well as the time off to receive the vaccine. And so, I think Councilmember Groom actually brought this up last week, and we weren't, at that time, hadn't had all the details of this, but received more information from the Department of Labor and Employment since then. And so I think it's in terms of reducing transmission, it's a positive, but understand that does have implications for the employer in terms of providing some of those. So I don't know if it sounds like there may be some follow-up questions that the businesses have, and if that's the case, we're happy to dig into the act a little bit more and try to get specific answers on that front, if that would be helpful. And then Jason, the last question was related to if we move into level clear, will masks be required? And I know that's been in discussion at the regional level that you might want to speak to a little bit as well.
Yeah, just back to my earlier point about that, I think we're waiting to see at the metro level what the governor is going to decide to do with the mask order that's currently in place. Some counties are looking just to extend their mask order because their mask order will expire prior to moving into level clear. So they feel like there's a gap period that they want to make sure is addressed. Other counties are thinking about if the governor's mask order goes away, do we just have mask orders in certain sectors, like again, in schools or childcare centers or places where you know that there definitely are unvaccinated individuals that haven't had a chance to get the vaccine. And then lastly, I believe there will be some counties that just decide that they don't want to move forward with another mask order and have it be more of a recommendation. So those are sort of the three options that are on the table right now.
Okay, thank you. It sounds like some of this too is sort of a wait and see. I know that a lot of people are frustrated, you know, at that balance of knowing if someone is vaccinated or not. And we will get into those travel orders, I think, soon too. With traveling, I went to Kenya and I had to get a ton of vaccines. So that part I don't think is very new. So, you know, maybe following up, I'll probably even ask more questions about what we're doing regionally to incentivize, but also I know that colleges are requiring, now a lot of colleges are requiring vaccines. So that'll be a crucial conversation, I think, in the coming month or so. Thank you.
Councilmember Lynn.
A few of my concerns were addressed. I would like to hear more information later too about, you know, depending on the circumstances at the time, when we go into level clear, to, you know, we seriously consider keeping that mask priority under level clear. So we'll see what happens later. I was ready to ask, as we're moving away to smaller events, are we doing any outreach to businesses to see if they want a vaccination, you know, clinic on site, or do we have any? And I think Jeff said he was talking about that with Deb, or that would be a possibility at some of our larger businesses. So that was good to hear. I was going to ask about that. Do we have, in our interactions with the school districts, do we have any insights into what impact the higher rates in the 10 to 19 age group? What impact is that having on school attendance, quarantines, or, you know, how are they functioning with that increase?
It's another excellent question. I don't have the specifics in front of me, but I do know that there has been some concerns among some of the superintendents with the increased cases that they're seeing, again, not within the school setting, but occurring outside the school setting. And then if you have a case, the quarantines that have to actually occur. And a couple things that came up is they're working towards it is what could be the potential impact on a graduation event if you had kids that were exposed either at home or at a friend's house or through another mechanism, riding in a car with somebody, and they come down with it, and then you have a case at school and we have to quarantine a class, and it leads right up to that graduation event. So we're trying to have those conversations with the district and the state to make sure we stay true to public health principles, but also being very aware of how can we do more education out to our public right now that this is where we're seeing the main driver of cases, and don't let your guard down with your middle school and high school students especially.
Okay, that's good. That was the communication piece was going to be my next question. Is it the school district or our county responsibility to try to educate, it would be parents, to that it's spreading among that age group, and to make sure that they're careful with those extracurricular activities where they seem to be spreading. So will we see something from our communication staff to target that age group and the parents of that age group?
Yeah, I think it'll be on both sides, both the school district and from us as public health and our communications department.
Okay, thanks. This is not something that you previously mentioned, but I had a question about vaccine records. So does the state have an immunization information systems office and that keeps the vaccine records? And are those being shared with primary physicians fully, or is it a kind of a hit and miss kind of sharing depending on the primary physician?
It's another excellent question. So the state does have it's almost an electronic health record for vaccines. And so anybody that gets a vaccine, the information's entered into that electronic health record. It's the Colorado Immunization Registry. It's often referred to as CIS. And providers and others have access to that. So again, a pharmacy could see it, a primary care physician, a local health department can all see what a person's vaccine status is.
Okay, thank you. Those are my questions.
Great. I'm not seeing any additional hands. Are there any additional questions? Councilmember Schaaf.
Thank you, Jason. I do have some questions. So with the rise in the school-aged youth, do we know, is there an increase in the transmission there in schools? Has anything changed within the transmission in schools or in sports clubs or extracurricular clubs, or is that continuing to be the same? Is that there's low transmission within those areas?
So my understanding from the actual school districts is the transmission is very low still within the school setting because of all of those mitigation factors. It's outside of the school setting. And I believe Sarah or Deb have our latest exposure data information and can talk a little bit more about the cases we're seeing with our adolescents. So you want to take that, Deb?
Sure. You're correct in what you said, Jason, that we continue to not see schools themselves as being the source of transmission in those school-age children. Additionally, as more sports have moved outside, we've seen less exposure risk related to participation in sports. So the two main drivers continue to be household. So one member of the household, and then it spreads quickly to all the kids, all the family members in the household, as well as that general community transition, which again is just, I know, frustrating but difficult to pinpoint. But that is the category of individuals that have been active in the community, going to activities, socializing, but we have not been able through the case interviews to pinpoint it to a specific social gathering or a specific site like the workplace. And so it remains in that category of general community transmission. We do know that mobility numbers are at their highest rates, and Sarah will keep me honest of since when, but they have continued to rise as people are becoming increasingly active in the community. And so I think we expect to continue to see that general community transmission bucket being a big factor.
And I know that Boulder County Health is kind of taking the lead on BVSD, and perhaps Tri-County is taking the lead with Adams 12. And so with that, I don't know kind of what Broomfield's area is in this, and maybe you can still answer this, but do our quarantines for our youth still need to be that 10 or 14 days within those school environments, or are they starting to have conversations about either not having quarantines, or are we just trying to get through the school year and then we'll figure out how we're going to do school next fall?
You guys have excellent questions because these have been a lot of the state updates over the last week. So the state is actually working on updated school guidance, and it will include updates on quarantines. Our team is involved, working directly with BBSD and with Adams 12, along with Boulder County Public Health and Tri-County. Again, there's 3 options for quarantines within schools. 14 days is the gold standard. You also have the 10 days, and then you have the 7 days if you have a negative test. And so the school districts do have that flexibility in consultation with our public health team, looking at that. And then there's other issues they can look at as far as they've begun to address, was masking actually occurring within the classroom when that happened, and was there direct exposure? So trying to more pinpoint those quarantines versus trying to take an entire cohort of 6th graders out. And those are a lot of the discussions that happen between the FE team and the school districts when these situations happen.
I appreciate that. So do we have, you mentioned this one, which made me rethink this question. So with the cases and the hospitalization, do we have numbers for kind of the percent of those cases and the percent of the hospitalizations for people that have the vaccine?
Yeah, I believe we showed that in the slide deck. Sarah, do you want to bring that up again? It may not be the percentages, which we could work on, Councilmember Schaaf. There were additional slides, but what this specific slide shows is the 7-day moving average of hospital admissions. And they were looking at those that among the breakthrough cases. So that's the purple line. Those are fully vaccinated people versus all other hospital admissions among COVID cases. So these are the people that are not fully vaccinated. And what we're seeing is it's trending exactly with what the clinical trials were showing, is that the vaccines are effective at reducing hospitalizations.
I'm so glad you mentioned that, because when I saw that line and I actually saw the slide, I thought that was just the bottom line graph indicating where, February 1st was, February 15th, March 1st. I didn't realize that those were the cases for with people with the vaccine. So that is incredible. I mean, when we're talking 0 and 1 cases on those days, it's truly incredible. So, like you said, the vaccines are working. The data that we saw in the clinical trials is spot on. So with so my last question, this was brought up by a resident about the MIT study that just came out. When I read the article, I couldn't believe that was what the MIT study said, was that we were doing away with masks and social distancing. So when I went back and looked at the MIT study, that was not what it was saying, and that it was saying that masks are still important. And the thing that it was questioning was whether the 6-foot distancing is something that can be relied on, or if this is something that needs adjustment. And basically their conclusion, and you can correct me if I'm wrong, basically their conclusion was that 6 foot is just kind of a standard, but it's not necessarily the correct standard. And perhaps that's something that they need, the conclusion was that this needs more study in what is adequate. And so they've developed an app, I believe, and they've developed kind of a framework for how to adjust what that distancing should be in those different environments based upon a whole lot of factors. One of those primary factors is whether or not people in that space are wearing masks. So mask was iterated over and over again. So I'm curious. One question is, Are we going to look into that possible app framework or kind of greater detail and see, can that be applied here in Broomfield? And then the second question, would we start to then adjust our social distancing? And I guess the caveat to both those questions is perhaps once we get to May 16th, which isn't too long away, all of this goes by the wayside anyway. So maybe it doesn't matter at that point.
No, I did see that study, and we've also seen some other studies being published recently on masks, and then the articles associated with it. And Councilmember Schaff, you're exactly right. You actually need to go in and read the studies to get the true conclusions. I think with the 6 feet of social distancing, the initial science again, and it was a standard they set based on respiratory droplets and transmission, was that you needed that 6 feet of social distancing. I know that the CDC is continuing to look at that, and we're currently following the CDC guidance. And so as the science emerges, I fully expect the CDC would be updating it just like they are doing right now with outdoor transmission and the need for masks. And if the CDC did change it, we would obviously re-examine that as far as a public health recommendation.
Great. Thank you so much, Jason. I appreciate all the information.
Thanks, Councilmember Schaff. Councilmember Anderson.
Thank you. These are some really great questions today. My only additional thought or question would be, as we start to move closer and closer to the time when there will not be a mask mandate in place, do we have any indication from some of the stores, especially some of the bigger stores or locations or shopping centers, that are any of them considering keeping they have the right to, and are any of them thinking about, trying to keep their business open by keeping masks on? Is that discussion happening out there at all?
That's a good question. And actually, I'll have to ask Deb and Jeff if they've been having those conversations. So I don't know if you have, Deb, or if not, we could definitely initiate those conversations.
Yeah, thanks, Jason. I don't have a sense of that. We've been interacting with businesses, but that's not one of the things. So, Jeff,
yep, and that's fine.
Any insight? Yeah.
Yeah, I mean, we're hopeful, and we've heard from some that they are attuned to the fact that there are still a number of customers and residents that are concerned. And several members of council expressed on this call, we're easing ourselves back into this as customers, and I think they recognize that also. So the good news is we're easing ourselves back into it when there's a lot of capacity for outdoor seating, and the temperatures have warmed up enough that there's better air circulation and windows being open. So, we'll find out what that new normal is going to look like. And I suspect for some places, they will continue to wear face masks, especially the employees.
And I do want to remind everybody too, with a level clear, we do have a snapback provision. It goes back to those hospitalizations. So if we did start to see things trending in a negative direction, we have the ability to snap back into some of these capacity levels. But I think Jeff's exactly right. A lot of our business community is really showing and stepping forward that they want to have the best protections in place to bring consumer confidence and customers back. And so Jeff's done a great job of working with the business community to help them through that process.
And I would just add to Jason's point, Deb and I were actually, there was an outreach from one of our largest companies in Broomfield. So it's not just restaurants. They're also many of our large companies are beginning to contemplate when they're bringing their employees back onto site. And at one proportion, they see the benefits of having their team members either wholly or in various parts coming back. And they're looking for us, and they want to understand what our guidance is going to be to help them. And these, many of these firms are the type that are, that you or I don't normally go into. So it's not a customer facing, but they are very concerned about their employees and making sure they feel safe too. So we're talking, the interlocking business parks and things like that. So this is across the board. Everyone is trying to feel comfortable, and they want to make sure the health of their employees is oftentimes at the forefront of their thinking.
Thank you. I think that's really helpful. And what Jason mentioned about the snapback provision. So it's not like it's a free for all. I think that brings some comfort to know that businesses still have the right to keep some provisions in place, and that there is some monitoring going on, and that we can react quickly if we need to. So I very much appreciate it. Thank you.
Great. Thanks, Councilmember Anderson. Well, I know we're approaching 5 o'clock, and whoever said it, these were excellent questions. Obviously, again, you're very engaged in the science discussion, and we look forward to continuing to have these conversations. And as I gather more information on what the region's going to be doing with masks, I'll share that with council. It may be tomorrow during a briefing, or if we don't have information by then, I'll make sure I share it via email so all of council's informed. And with that, I think that concludes our presentation. So appreciate you all.
Great,
Thank you.
Jason.